Hi, I'm Dr. Helene, the woman who personally experienced when the Viagra failed us that morning. You are in the right place if you want to know what exactly is erectile dysfunction and how does it work or not work. But before we get started, to get the most from this video, turn off your phone, close all other tabs and windows, and get rid of any distractions to focus on the next few minutes into what we will talk about today. You also might want to grab a pen and a paper because you will want to jot down some notes. If you have any questions, please don't be shy. Ask me any questions you may have, and we'll be back to you as soon as possible. You can email them to me at info@malabedmethod.com. What I will be talking about today in this video are the facts about erectile dysfunction, and by the end of the video, you will be clear about the common causes of erectile dysfunction. Hi, I'm Dr. Helene, the woman who had personally experienced ED when the little blue pill failed us. Many causes cause erectile dysfunction, and on this video I will talk about each of them. 1. Medications. Every type of medication, pill, and supplement has a side effect. It's a matter of whether they affect you or not. And since everybody's chemistries are different, it's impossible to decide whether someone will react to a particular medication, pill, or supplement. Many of these medications can decrease the blood flow to the penis, thus causing trouble with obtaining and maintaining an erection. Discuss with your doctor about changing medications to see if it will improve your erections and overall sexual performance. But please talk to your doctor first before you stop taking any prescribed medications. 2. Medical conditions. Certain types of chronic illnesses or diseases can affect the way your body sends blood to the penis. If you have any problems with any or some of these systems, it can lead to potential erectile dysfunction troubles, such as for the arteries, veins, nerves, kidneys, liver, lungs, and heart. Nearly every major part of your body can in some way affect the way you maintain your erection. In fact, ED is a signal that something bigger is going wrong with your body. This is why men should get themselves checked out by their doctors and pay attention to their health. On the other hand, a lack of testosterone can be the main reason you have erectile dysfunction. So if you've had a loss of interest in sex, feel sluggish, depressed, you see a pretty girl but you don't think anything of it, it's a good sign you may be lacking in testosterone. This is a time to talk to your doctor about testing your testosterone levels. Just because it's low doesn't mean that might be the problem. With heart disease, high blood pressure, and diabetes, plaque buildup in your arteries can hinder blood flow throughout your body, especially your penis. Emotional troubles. Your brain is in control of your whole body. If your brain is preoccupied with stress, anxiety, and depression, it can't experience pleasure. This may be the cause of your erectile dysfunction. Your body will only do what your brain tells it to do. So if your brain isn't able to focus on the body's needs, a few bodily functions will suffer. Drugs and alcohol. Suppose you have a substance abuse with legal medications that have been prescribed or not prescribed. In that case, that can put you at a higher risk of erectile dysfunction. Drugs and alcohol hinder the body and the mind, thus enhancing your arteries and vein trouble. This decreases the blood flow to your penis. This is especially the case when you're been using drugs and alcohol for a long time. You may have done irreversible physical damage to your body, which may result in permanent problems with ED. High body fat. Being overweight can put yourself at risk for erectile dysfunction. Since the excess pounds put a strain on your body and cause your body to work harder than it should, you might be having trouble getting the blood flow to your penis. Excess body fat can also mean clogged arteries and veins, which means not enough blood flow can get to the penis for an erection. Being overweight is also linked to a metabolic disorder, which means your blood pressure and your cholesterol, as well as with your ability to process sugar, is compromised, therefore compromising the blood flow to the penis and causing erectile dysfunction, which may be irreversible. Injury. If you've ever had a penis injury, you may be at risk for erectile dysfunction. This risk also includes any lower body injuries that might be connected to the function of the penis. If you're unaware of any injuries, you might want to talk to others who may be able to give you an idea of what events may have been likely to contribute to the erectile dysfunction troubles. Even minor injuries can cause major problems. So when talking to your doctor, make sure to discuss any intentional or unintentional penis injuries. Surgeries. Suppose you've ever had surgery that involved your genital area or that involved the arteries and major organs of your body. In that case, this might put you at risk for erectile dysfunction as well. Whenever you disrupt or change your body works, you put the rest of your body at risk for future problems. Smoking. Men who smoke have a greater risk of developing ED issues. Since smoking constricts the blood vessels all over the body, there can be troubles with blood flow into the penis, leading to greater troubles with erection maintenance. Certain exercises. Anything that places a lot of pressure on your penis and your scrotum can be problematic for maintaining erections. For example, men who bike for long distances can be at higher risk of erectile dysfunction issues. This is not to say that exercise is bad, just that some exercises may need to be done in moderation with protective gear to help the biker protect their sexual function. By knowing these risk factors can help you make healthier choices in your life, thus allowing you to maintain your ability to have erections for a long time. At the same time, you need to keep in mind that while some men might have all of these risk factors, they may not also have any troubles with their erections. This list may not apply to your situation. Some men just have erection problems without any risk factors. Click here to take the What's Your Number One Erection Killer quiz so you can start having satisfying sex.